trying to, there we go. Let's go back to the PowerPoint. So the hyoid bone is a bone that's right below the chin and just above the thyroid cartilage. It's a very small bone that serves for attachment of bones in your neck, and in order that you can move your neck around, but it's it seems to be floating in space, but it's attached obviously to tendons and ligaments, and muscles are attached to it. The skull of a newborn has fontanelles. The fontanelles allow the compression of the fetal skull when the baby moves through the birth canal, when babies are born. These, as the baby grows, these fontanelles are sealed and they disappear. Everybody knows about the soft spot on the top of the skull of an infant, but there are other fontanelles. You should just know the purpose of the fontanelles is to make sure that, again, that the fetal skull can compress so that the movement through the birth canal is made easier. So we have the anterior fontanelle, the occipital fontanelle, and the sagittal suture. So we'll have questions about these sutures, but just know that the fontanelles are spots where the skull can compress. Okay, we should know that there are 1, 2, 3, 4 classes of vertebra, 7 cervical, 12 thoracic, 5 lumbar, and the sacral formation. So you'll be able to recognize the structure of a cervical vertebrae, thoracic, and lumbar. So what are the parts of a vertebra? So here's a cervical vertebrae. There'll be questions about the vertebral foramen, the body, transverse process, spinous process. So this is a cervical vertebra, and you should be able to recognize the atlas and the axis. We'll get to that in a moment. So here's a lumbar, a typical thoracic vertebrae, and here's the central vertebral foramen, the lamina, and so on. We'll focus on the spinous processes, the transverse processes, and the vertebral foramen where the spinal cord is. So this is a typical thoracic vertebra. Then we have a typical lumbar. Notice the differences at the size of the body, the transverse processes, and the size of the vertebral foramen. The atlas and axis are the two top cervical vertebrae. Your skull sits upon the atlas C1 and the axis is below. You should be able to recognize or know about the atlas and the axis. So they are two top cervical vertebrae on which the skull is resting and allows you to rotate your skull and move your skull backwards and forwards. And so know that C1 is the atlas and C2 is the axis. Okay, we're moving to the sacrum. It protects the pelvic organs. The base connects to the lumbar vertebrae, and the tailbone is at the base of the sacrum. So what's that look like? So here's your fused sacrum. The coccyx is the tailbone. If you fall strongly and end up sitting down and you get knocked off your feet and you fall with much speed as you hit the ground, you can break your coccyx. It's supposed to be incredibly painful. I have never done that, so I hope nobody breaks their coccyx. All you got to recognize that the coccyx is the tailbone and the sacrum is the fused vertebra just below the lumbar and just above the tailbone. Here's another view, the interior surface. You recognize the coxal bone, and I won't ask any of these questions. Just want you to know it's the sacrum. So we're going to look at the thoracic cavity formed by true ribs and false ribs and the sternum. So the sternum has the upper portion called the manubrium, the sternal body, the xiphoid process. True ribs are 1 through 7. False ribs are 8 through 12. The true ribs are attached directly to the sternum by the cartilage here, the costal cartilages. So you should know these structures. We're not going to worry about the fine structure of ribs. Here's another view of that as an image. You should know manubrium, body, xiphoid process, costal cartilages. So see the true ribs are attached directly to the sternum. The false ribs have this one attachment, but they're not directly attached as are the true ribs. You have also floating ribs. Okay. Let's stop there. Well, let's keep going a little longer. So the pectoral girdle. So you should know the structure of the scapula and the collarbone, and arm movement is when the humerus forms a joint with the scapula. Know these parts of the scapula. So you may have to look up another image. The images will be on Webison. Recognize a clavicle. I'm not going to ask you about the acromial end or the sternal. Just know that this is a clavicle. Oh, here's the scapula. So there will be questions about the glenoid cavity, the acromion, the coracoid process. So the acromion, the coracoid process. Here it is, acromion, coracoid. This is the joint where the humerus contacts the scapula. Okay, let's stop there. Let's go back to the view here. Let's stop recording for a moment. Stop.